off.
Okay. Yeah, I should turn this off.
Good idea. Yeah. Very good idea.
If I make sure the phone's not ringing, I can look at it to answer it.
Hate that. I always turn it and it turns itself on. But now mine's turning on.
All right, I'm muted as well here. Perfect.
Yeah, I don't get anything.
Mine's not.
Okay, so this phone number, Dr. Singer, is for the phone I answer, correct?
Yes.
Okay, it didn't ring, didn't even go through.
What do you mean?
But it didn't ring when I called. And it didn't show up here.
It did yesterday.
Yeah. I've already taken a call this morning, so, but I just turned it down as low as it will go.
Okay, I can't do it right now.
So we can just.
Trying to turn off these
Phones.
All your ringers.
Just press softly. Nothing happens.
That one is definitely turned off.
Good appear. Power off. Yay. Okay, this one's off.
Double checking this one.
Yours okay?
All right. All looks good.
We won't be able to do that. I don't think.
Yeah, that's one we'll have to mute out.
The low. Will that be a
That is
problem?
the low.
Yeah, I can hear it.
What if you take the phone off the hook?
Yeah, let me just take it off the hook for now.
Leave it on busy.
There.
It'll probably beep for a while.
Yeah, but I can put it in the door.
All right. So,
All right.
reminder, we're going to, obviously your focal point's going to be the camera. Give yourself, when we start, each section, a mental kind of 3, 2, 1, so we have a good cut-in point. And when you finish each section, again, stay focused on the camera for about 3 seconds so we can have a good fade-out point.
Can I put a piece of paper in front of you in front of the computer with my cheat sheet?
Sure. As you know, here's the only issue with that, as long as we're not, because if you're glancing down like this,
yeah, well,
it'll
that's
be
why I want to
noticeable.
put it up here. Like that.
You like just tape it up there?
Mm-hmm.
Yeah, if you do that, that'll be easier.
And then you're just looking at the camera and looking to the side like you do when you actually do TV, like a monitor, a prompter.
How's that? Is that in the way?
I don't see anything, no.
Okay. All right.
All right, so let's start off with the breast augmentation.
Breast augmentation. Okay.
So I'll start off, and the first section, we'll do that first section first. Then we'll come back. I'll prompt you for the patient example. Then we'll go into
That's the thing I don't have is a patient example. But
you'll probably be able to rattle that off in your head. For example, I had a patient who, we'll just talk, you know what? Let's shoot everything else. And then if we need the patient example, we'll put that in there as well.
yeah.
Okay. All right. So, Dr. Singer, what would you recommend someone go about doing if they're looking for a great plastic surgeon for a breast augmentation?
Oh my God.
Well, I think the first thing I would say is that they should check and be sure that that person is certified by the American Board of Plastic Surgery. There are other boards, but the American Board of Plastic Surgery is the one that they should be looking for. And then the second thing I think would be
we got too much noise in the background.
too much noise in the background. Okay.
Yeah.
seems to have stopped.
Okay. Let's try it again.
Sure.
Let's try it again. Okay, Dr. Singer, what would you recommend someone do? How would you recommend someone go about looking for a great plastic surgeon for breast augmentation?
Well, I think the first thing you need to do when looking for a really great plastic surgeon is be sure that they are certified by the American Board of Plastic Surgery. Not any board, but the American Board of Plastic Surgery. And then the second thing would be to see their experience in breast augmentation. For example, you could ask them how many cases they had done or how familiar they were with the procedure, maybe how much they liked doing that procedure. Because if it's a passion of theirs, they're likely to spend a lot of time in that. And then I would ask them how to assess how comfortable they are with that doctor in the world of breast surgery. And do they feel confident about the doctor? Maybe ask for some before and after pictures to see that doctor's results.
Great. Good. All right. So section 1 complete. Let's go into let's try to get that patient example in there. Let's kind of brainstorm quickly on that. For example, I found a patient who had found us online. She talked to me. She was very comfortable with the surgeries I'd done in the past, and something along those lines where you'd be able to kind of fit that in there.
For example, I can think of a patient I just saw this past week who found me online and came in for a consultation. We talked. She felt quite comfortable. She said she felt quite comfortable, in fact, with me and with the proposed procedure. She liked the before and after photos that I showed her and said that was exactly what she was looking for. And she went, ahead and scheduled her surgery.
Good. Okay. Let's see. Let's go into talking about your points of differentiation and what really sets you apart from some of the other plastic surgeons as far as breast augmentation goes. You know what? Hang on one second. We've got our internet is slowing down. It's not coming through in high definition right now. This is one of the drawbacks of the Google Hangout versus the Zoom.
Okay.
We got to wait till it comes back in high definition. Otherwise, we're doing all for naught here. Let's see. On the top of your screen, Dr. Singer, you should see right next to your little settings kind of gear to the left of that. It kind of looks like I don't know what you want to call that.
Here?
Right next to the settings gear on the left, where it says adjust bandwidth.
Bandwidth.
Is that set up to auto HD?
Yes, it is.
It is. Okay, good. And you know what? It's coming back here. All right, we're better. All right.
We're better.
So
Okay,
sometimes
good.
it just happens where it blips in and out. There's nothing you can really do about it. So let's go through that patient example one more time briefly here.
Patient example again.
One more time briefly when it comes to a breast augmentation.
Okay.
No, we lost it again. Oh, it's back. Okay, go ahead.
I recently saw a patient for breast augmentation. She had found me online. She and I spent some time talking together about what she wanted. She looked at the pre and post-op photos of patients I had performed this procedure on and was very happy with that. She told me she was very comfortable with me. And she said that picture, she found a picture that was just exactly what she wanted. And that was possible for her. So she went ahead and scheduled her surgery.
Great. Very good. All right, let's go in and let's start talking about the points of differentiation, between you and some of the other surgeons when it comes to a breast augmentation. If I'm going to have you back up a few inches like you were before. There you go. Perfect. 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 All right, go ahead and let's talk about those points of differentiation, Dr. Singer.
I think that some of the factors that differentiate my practice are that I spend a great deal of time talking with the patients. I really want to find out what they want to achieve, and by examination, see if that's feasible for them. And we discussed this in some length. I think some of the patients maybe feel more comfortable with me with regard to breast augmentation because I am a woman, and they just feel that that's who they want to take care of them. And my qualifications are really high. I went to Harvard undergraduate, Harvard Medical School. I am certified by the American Board of Plastic Surgery, so that all of those that I had mentioned earlier they felt great about that too. So they were happy with that. And I really care about my patients. I think they are great, and we have a terrific relationship. I think that's a main part of my practice that's very different from other practices.
Good. Okay, let's get into that last sentence. If anyone wants more information, they can go to your website or give your office a call, and then give that tagline there at the end.
Okay. And if anyone wants more information, you can go to my website at www.karensingermd.com, or you can just call the office 727-547-9244, and we'll be happy to schedule you an appointment. We provide plastic surgery with a woman's touch, and really that's what it's all about.
Good. That was perfect. All right, let's move on to section 2, or not section 2, topic 2. I have a tummy tuck in here. Is that okay for you to go number 2?
That would be okay.
All right, wonderful. All right, so Dr. Singer, what's your advice for someone that's out there looking for a plastic surgeon for a tummy tuck?
Well, in looking for a plastic surgeon to perform a tummy tuck, first of all, as always, be sure they are certified by the American Board of Plastic Surgery. And then you would also want to know what's their experience with tummy tucks or abdominoplasties, as they are called. Have they done a lot of these? Are they comfortable with them? Do they enjoy doing them? And then another thing may be advice from their regular medical doctor that referred them, or a friend who had an abdominoplasty done by that plastic surgeon, and they were happy with, they liked the results of their friend, and they can go there. All of those are very good ways to look at a plastic surgeon.
Good. Good. All right. Let's go ahead and do that one more time. We had a little bit of, in that degree there, I could see motion in the background. It's the reflection.
Okay.
And there's a little noise in the background too on that one. So we don't. If we have the banging around, it's not gonna. There's gonna be too much. It's not gonna be worth your while. So let's go ahead and try and shoot that one more time.
Okay, which one?
The same one. The advice on a tummy tuck. Someone out there looking for a tummy tuck.
Okay.
And I'll have you back up. There you go. Perfect. Perfect. So, Dr. Singer, what would you recommend someone do if they're out there looking for a plastic surgeon for a tummy tuck?
For a tummy tuck, I think it's important to, of course, make sure that the plastic surgeon is board certified by the American Board of Plastic Surgery. And then go visit, do a consultation, see how comfortable you are with that plastic surgeon, look at their pre and post-op photographs of that particular procedure, the abdominoplasty or tummy tuck, and see if you like what you see. Someone's experience in that area, if they do a lot of them, would be, of course, a good thing to look for your doctor. And then how comfortable you are with that plastic surgeon. I think all of those are really important with regard to abdominoplasty.
Great. Good. Okay, let's do second part. Let's go into a patient example. A patient you could think of that recently came to you for an abdominoplasty that ended up with either a good result or was very happy with you and then went ahead and decided to schedule.
I did recently see a patient who came in for an abdominoplasty, and it turned out that she didn't need the full abdominoplasty, but a mini abdominoplasty. Those patients are not the most common, but on her, it would work, and I could see that and told her that, explained it to her, and she was just thrilled with the idea. She went ahead and had that procedure. I was very happy.
Great. All right, let's move on to the points of differentiation between you and some of the other surgeons performing abdominoplasties in the area.
I think one of the key points that differentiates me from some of the other plastic surgeons in the area with regard to abdominoplasties is that I do take my time. I don't race through the operation. I'm fairly meticulous and perfectionistic, and I think that's probably a good thing in a plastic surgeon. Another thing is that I'm well qualified for the procedure. I do a lot of these. I love body contouring, and I can show pictures of patients who have had the procedure before and afters. And I think most importantly is that I really do care about my patients, and they get that. They really sense that. I spend time finding out what they're after, and I look to see if that's achievable. And if it is, then we usually hook up right then.
Good. Okay. I'm sorry. I was had myself muted there. All right. Let's go into the end there again. If anyone wants more information, and then we'll go through that part right there. Let's just make sure we don't have any chattering in the background here.
Yeah, I was just waiting. Okay. If anyone wants more information, please feel free to look up my website, www.karensingermd.com, or call me at 727-547-9244, and we'll be happy to take your call. We do provide plastic surgery with a woman's touch, and really that's what it's all about.
All right. Good. All right. Let's get into the third topic here of liposuction, and we'll take it right from the top. So, Dr. Singer, what is your advice on, or for somebody who's out there looking for a plastic surgeon for liposuction?
I think if you're looking for a plastic surgeon who's done liposuction, this is really extremely important to look for someone who is board certified in plastic surgery. Many other specialty trained physicians do perform this operation. So I think that is one of the really critical things with regard to liposuction. Again, I think that experience is important. If they've done a lot of liposuction procedures, how they've done them, have they done them under local anesthesia, general anesthesia, and all of those things, and the patient's desires and what they're looking for. And then who recommended you to them? Is it your family physician? They may know about their reputation in the community, or perhaps your friends and you saw their liposuction results, you were thrilled and you thought you wanted that for yourself. A lot of times we combine these in the mommy makeover procedure so that the breasts are lifted and the tummy is flattened.
All right, good. Let's move on to a liposuction patient example. Give us an example of a patient that came to you as looking for a liposuction that ended up having a great result.
Hang on a second. You're on mute.
Oh, there we go. Now I'm off.
Yeah. Hang on a
We've
second.
got a little bit going on in the background there.
Yeah. Okay. All right. So now where are we? Patient?
Little patient example on a liposuction.
Recently, I've been exploring a new technique in liposuction called tickle lipo. And I did a very interesting procedure on a patient who had had a previous liposuction and was able to correct her deformities by liposuctioning a different area and using the fat from there to fill in some of the defects. And she is absolutely thrilled with her results.
Good. Okay, let's get into, excuse me, a little bit about what really differentiates you from some of the other plastic surgeons that are performing liposuctions around your area.
One of the major differentiation features for my practice is that we are offering this new tickle lipo, which is less painful. It can be done under local anesthesia if that's what the patient is looking for. And that's not available in most places and with most physicians. Another thing that's different about my practice is that I do a great deal of liposuction. I've had a lot of practice in this procedure and can show patients pre and post-op photos without any problem. And most importantly, I have a great staff and they treat the patients wonderfully, and I really care about my patients.
Oops, good. Okay, let's get into that last quick closing quote here. One more time.
And if anyone wants more information, please feel free to look us up on our website, www.karensingermd.com, or call us on 727-547-9244. We do provide plastic surgery with a woman's touch, and really, that's what it's all about.
Good. All right, that was great. Let's get into the last section here, the last topic, I guess, if you will, about the breast augmentation revisions. And we're gonna have to wait a second here. We lost our internet, blipped out one more time, unfortunately.
Okay.
Give you a chance to. Auto HD. Wonder why it does that.
I don't know.
Are you seeing it on your end as well, or just is it just on my end?
Well, I don't see anything. It just says live HD on the right.
Okay.
It does say HD. So your end, I guess.
Yeah, my end. I mean, my end is. I'm coming through in HD.
Yeah.
I don't have yours right now, unfortunately.
Oh, okay.
So still waiting.
Okay.
Still waiting. Usually just comes right back. Maybe if we adjust that bandwidth down and then back up again, see if that does the trick.
Okay, it's up again.
All right. Let's see what we got.
It's not going away. There. Okay. Now?
No, not yet. It's getting better. All right, there we go. Good. All right. That did the trick. All right, so let's get into that final topic, the breast augmentation revision. Dr. Singer, what would you recommend someone do and look for if they're looking for a plastic surgeon for a breast augmentation revision?
Breast augmentation revision is really almost a separate field unto itself. People who perform this type of operation really need to be very familiar with breast augmentation, first of all, and then with revision surgery, because it is more complex than straightforward breast augmentation. So I think that experience here would be one of the #1 criteria that I would find out about my plastic surgeon, and ask them how many they had done, ask for looking at pre and post-op results in photographs. I think those would be really important. Of course, be sure that they are certified by the American Board of Plastic Surgery and that you are comfortable with your plastic surgeon, because this is, like I said, more involved surgery than a straightforward breast augmentation.
Good. Okay, let's get into a patient example that you could think of of a breast augmentation revision that you've done. Doesn't necessarily need to be super recent.
Hang on a second.
Sure.
Okay, I think we're good. You ready?
Whenever you're ready, go ahead.
Okay. There was a patient that came in, not that long ago. She had a problem called capsular contracture, where the implants feel hard, and we had to remove those and the tissue surrounding them and replace them with new implants. This is not, as I said, nearly as straightforward as an original breast augmentation, but she did beautifully. Her breasts are soft now, and she is just thrilled with her results.
Good. Okay, let's move on to your points of differentiation when it comes to a breast augmentation revision versus some of the other surgeons around your area.
I think with breast augmentation revision, I have done a lot of revisions. A lot of the breast augmentation originally was done maybe years ago, not by me, but they come in with a problem, and we look at the different options and choose the best solution for that patient. I think I really focus on what's best for that particular patient. It's not a cookie cutter kind of method. And then I think that because I've had a lot of experience in this, I can show them pre and post-op photos, and I really do focus on my patients, what they want, what they're trying to achieve, and I care about them a great deal and have a terrific staff to support me. So all of those factors, I think. And the other one is a lot of women feel more comfortable with a female plastic surgeon. So I'd say those are the differentiating features.
Sorry, I'm muting myself there. All right, let's go into that last section one more time.
And if anyone wants more information, feel free to look up my website, www.karensingermd.com, or call us at 727-547-9244. We do provide plastic surgery with a woman's touch, and really that's what it's all about.
Good. All right. I'm glad we got that last one because there was a little blip in every one of the other final cuts. So now we got that last one. I can use that for all four of them. Great.
Oh,
Perfect. All
yeah,
right.
I heard the door slam in one of this last one. I hope you didn't.
I did not.
Okay, good.
I did not, but I think that went pretty well here. I don't think we need to do anything again. I'm going to stop our broadcast.